name's Jay Dolis. I'm a fourth year biomedical engineer. I co-opted at Guidepoint Laboratories in Gainesville, Florida. We didn't really have a specific product. We had a line of different genetic tests that we offered that I would develop that would be performed within the lab. We were looking mainly at diagnosing different types of cancer, such as colorectal, esophageal, and prostate cancer. We're also looking at determining rates of drug metabolism based on genetics. My normal day consisted of research into the different tests that we were doing, the different genes that we were looking at, and then trying to apply my research into developing a test to see what genotype an individual would have, or looking at microRNAs to see and quantifying them to see whether the patient had some sort of disease.
Hi, my name is Nicholas Galati, and I'm a fourth year biomedical engineering student. I first co-opted in the lab with Dr. Lepisco here at RIT, and then I co-opted most recently at CRIT Biosciences in North Billerica, Massachusetts. So formerly I was a tech support scientist. I worked with the tech support team at CRIT Bioscience. My primary job was to collect and catalog information from publications that contained information obtained with the device made by CRIT Biosciences.
Hi, my name is Amanda Murray. I'm a fourth year biomedical engineering student, and I did my co-op at Stryker Spine. We reported MDRs, which are called medical device reporting, and we would submit these every month to the FDA, and I would work on a daily basis to get complaints that were filed by surgeons and patients through the system. The main problem was really completing FDA requirements, and if they didn't stand up to the specifications that we set, then we needed to recall the product and change the specifications or engineer the device differently so that it followed the specifications.
My name is Dylan. I am a fourth year biomedical engineering student, and I have co-opted 3 times. First at the lab of Dr. Lepisco at the RIT Department of Biomedical Engineering. Second at the Neural Stem Cell Institute in the Rensselaer area, and thirdly at the SUNY Center for Nanoscale Science and Engineering. At the Neural Stem Cell Institute, actually, I worked with a team of tissue researchers who were trying to develop a cure for certain kinds of degenerative ocular diseases, and they were actually working in a mouse model, which is they were doing research on mice, and one of the big problems that they were having with their research was the difficulty in performing surgical procedures on such a small area because the mouse eye is very small. And I ended up designing a device that helped them to hold the mouse eye in a position that allowed them to conduct their research more quickly and repeatably, and also made it easier to train new technicians on their procedures. So yeah, I'd say that the overlapping knowledge between the more engineering side of our education and also a lot of biomedical considerations like the anatomy of the eye, what sort of considerations you have to take into account when working with a physiological system. Those were very important because it allowed me to communicate with the tissue researchers and also to do more of a mechanical design.
My name is Caitlin Bussey. I'm a 5th year biomedical engineer, and I've done a year's worth of co-ops now, starting at the Wake Forest Institute for Regenerative Medicine in North Carolina, and then here at RIT in the Nano Biodevices Lab, and then finally at Janssen Pharmaceuticals in Springhouse, Pennsylvania.
I'm Morgan Stussel. I'm a 5th year biomedical engineer as well, and I have co-opted with the Women in Engineering program here at RIT, Janssen Pharmaceuticals in Malvern, PA, and Orthoclinical Diagnostics in Rochester, New York.
And I worked under the Pharmaceutical Development and Manufacturing Sciences Division under Janssen, and my main project was vaccine development and technology upscale. So I worked a lot with building bioreactors and design of experiments within those bioreactors, primarily with media type and composition. So the cells respond to the different components of the media and will grow differently, experience different growth profiles. So I was trying to find the best one for the media to create the vaccine.
At Orthoclinical Diagnostics, I did feasibility testing and proof of concept for a new clinical chemistry system. So Orthoclinical Diagnostics does diagnostic medicine. So blood, urine, and cerebrospinal fluid get tested when the doctor tells that you need a blood test. they grab your blood and then they stick it in a machine. And so OrthoClinical makes those machines. And so we're working on a new clinical chemistry system.
My name's Kayla Wheeler. I'm a fifth-year biomedical engineer, and I've co-opted at Strain Measurement Devices in Connecticut, and also I've co-opted for my startup through the business school. We basically came up with a startup idea of creating headgear to prevent against concussions, particularly in non-helmeted sports. We're working on the customization aspect of the headgear. So we're essentially creating padded foam that we can implement into helmets and also into headbands for non-helmeted sports. And we've had our products third-party tested, and basically they perform statistically better than what's already out there, so we were really excited about that.
Hi, my name is Lindsay Domblowski, and I'm a fourth-year biomedical engineering student. I've co-opted at Mine Safety Appliances. I've co-opted with Engineering World Health in Rwanda, and I've co-opted at Thermal Gradient. So Thermal Gradient does a point-of-care device to detect if a patient has HIV or tuberculosis or other diseases using polymerase chain reactions in less than 8 minutes. So the conventional method takes 45 minutes. Real engineering techniques, you really have to think, you really have to come up with your own designs, your own experiments, and use a lot of what I've learned in my classes.
My name's John Ray, and I'm a fourth-year biomedical engineering student. I co-opted Santa Fe Pasture in Swiftwater, Pennsylvania. Our problems, more or less being in the flu support lab, was to test different strains of vaccine to see if we could improve the efficiency of the vaccine made at the end of the process. So we changed small parts of the whole week-long vaccine making process and see what produced the best results.